My name is Sara Russo, and for my speech I chose to do something that I have a lot of knowledge on and a lot of experience with. Among the 4 children in my family, I am the fourth ACL that has been torn, and today I'm going to talk about what the injury is and how it's diagnosed, the pre-therapy that you do before going into surgery, the surgery itself, and the recovery that happens once the surgery has been done. So what the injury is, the ACL stands for anterior cruciate ligament, and it is a ligament that runs sort of diagonally in between your knee, and it holds together the tibia, which is the big bone in your shin, and your femur, which is the big bone in your thigh. And here is a picture of that. So the first thing that happens as soon as the injury happens is a trainer or a coach, if he has knowledge on it, or a doctor if there is no trainer, somebody like that is going to do what is called the Lockman's test. And what you do is this person will take both of their hands and sort of jerk your knee up and down, and they'll do that to your good knee and also to your bad knee. And they'll do it to your good knee first, and it doesn't hurt the injured knee if your ACL is torn, but what they feel for is something that is loose or missing, and they can tell if a major ligament is not there. So this injury is more prevalent in females, and that is because of our anatomy, and females have wider hips, so our bones sort of run diagonally down, so our knee anatomy is completely different in males because their bones, they don't have wide hips, and their bones just run straight down. So there is a lot of research being done on this, and after the Lockman's test, you will go see a doctor, and he will order an MRI to see if it was actually torn. Then you will know for sure. And also, a lot of them order an X-ray because a lot of times when the ACL tears, the 2 bones hit together, and it causes internal bruising, and this is shown in the X-ray. So now I'm going to talk about the pre-therapy, which is usually lasts about 3 weeks. It can last up to 6 weeks depending on how long you have to wait before you get your surgery. And this pre-therapy is all about building up the strength in your quad. So there's no running or pivoting or jumping or anything like that. It is all doing things with like weights around your ankles so you can have a really strong quad going in. And a really strong quad going in leads to a better outcome and a better recovery after surgery. So a lot of therapists and trainers and doctors that have different ideas, but a lot of them think that the reason the ACL tears in the first place is because of a weak quad. So these few weeks that you were waiting for the surgery is also because an ACL tear in most people causes a lot of swelling in the knee, and you cannot go into surgery with a lot of swelling. They will not operate if there's a lot of swelling, so you have to wait. The surgery itself, there are a few different kinds you can get. You have to get a graft from somewhere or something to repair your ACL. And you can either get it from a cadaver, a dead body, which is not very common because that causes a lot of problems. It works for some people, but it has shown to have many problems when you get the graft from a cadaver. The one that was done most often, like 5 to 10 years ago, was to get a graft from your patellar tendon. And so when you get that surgery, it leaves a scar like this. And this one also causes a lot of bruising. So here is a knee, and it causes bruising all the way down. This is my shin, and even all the way down into the foot, which is not shown here. And the patellar tendon surgery is said to be the most painful, and nowadays most people do the hamstring surgery to get the graft from your hamstring, which leaves a scar like this. This is one of my friends who did the hamstring surgery. And I chose to do the patellar tendon with my doctor because my sisters did that a few years ago, and they did really well and were really successful in that graft, so he chose to do that one for me too. And the 3 surgeries are all very different and can lead to different complications in the long run in your recovery. So for the recovery, according to emedicinehealth.com, it can last from 6 months to a year, and this varies on age and what level of play you want to get back into. So an older person, a middle-aged person that really doesn't play sports, of course, or is just wants to be able to walk again normally, and then they will not have near as long as recovery as someone's trying to go back and play a college level sport. So the recovery, it's an everyday thing. You're usually with a physical therapist a few days a week, and then when you're not with him, you're with trainers or even by yourself at home, if you have the means to do that, or you can go to a gym or anything like that. So something about ACL surgery is that in the recovery, they say the bending, which is called the flexion, comes back on its own and over time, and the extension, which is being able to straighten your knee out completely, actually has to be forced back. So the first few weeks up into a month and a half after surgery is all about getting your strength back, of course, and also getting your knee straight. So a lot of time is spent, like 20 to 30 minutes in therapy is spent with the therapist either pushing down on your knee and having a lot of weight. I have a sandbag that I use it's like 15 pounds, I think, that sits on top of my knee. I'm still working on getting mine straight months after. So it's important to take therapy seriously because knee injuries can lead to lifelong issues and arthritis. So the reconstruction of one's ACL involves a lot more than just a few hours on the operating table, and I hope that I have been able to educate you on the entire process of ACL surgery and recovery. Thank you.